And get started. I think we'll probably still have a few folks trickle in, but for the sake of time and for everybody's busy schedules, I want to go ahead and get us started. Good afternoon, everybody. My name is Candace Bailey, and I am the HCPF Division Director within the Office of Community Living here at the Department of Healthcare Policy and Financing. And we are here to discuss the long-term home health rules. So this is the Rule Revision Work Group. And today is November 20th, 2024. I have no idea how it is already that date, but the slide tells me that's what it is. So we're going with it. All right. I have a number of folks that are on to help support all of the questions and help provide information to you all today within the department. So we are going to do our best to answer questions as they come in the chat, things like that. But we will go ahead and get started. Next slide, please. All right, just to remind everybody, we like to ground ourselves in our mission at the beginning of each of our meetings, which is improving healthcare equity, access, and outcomes for the people we serve while saving Coloradans money on healthcare and driving value for Colorado. Next slide, please. Just also another reminder for the purpose of this particular meeting and this particular work group. It is for members, family members, advocates, providers, case managers, basically anybody who's interested. To work with us and collaborate and advise us on the review and updates for the long-term home health regulations, which can be found at that link. Folks will be dropping in links into the chat as we go so that you can access them all too. Next slide, please. The agenda for today, so just as a reminder, this is not our first meeting for these regulations, and so the agenda is pretty much identical. I skipped HCPF introductions because there's several of us and you guys don't want to sit here for an hour listening to who we all are. No, we have some really smart clinical folks and really great policy folks on the line. So should you have questions, we have appropriate people here that can help. If you are attending from outside of HCPF, please complete the attendance form, which Christine just dropped into the chat. Thank you, Christine. That way we know who was able to attend, who was able to participate, all of the good things. And keep track of that. Housekeeping, if you are not talking, please mute. If you want to talk, please raise your hand. Happy to have other folks chime in. It's really nice to hear from other people as well. So just the normal things. And then also, of course, this meeting is being recorded. So please, please, please do not share any protected health information, PHI, at all. Otherwise, we cannot post this recording. And then we'll go over the goals of this meeting. Red line review of the changes and the decisions that have been made, and next steps for feedback. All right, housekeeping. I hit some of this already. Please mute yourself when not speaking. It just helps with background noise. It's really hard for, I know for me to tune out or to be able to filter away from the background noise. Please let us know who you are before you speak. Sometimes names are misleading. Sometimes we're on other people's accounts or computers or things like that. Raise your hand and unmute yourself once you're called upon to provide some feedback, comments, suggestions, questions, all the good things. Please feel free to also use the chat box to enter in questions or comments or suggestions. We are gathering everything that is entered there, and we'll be taking all of that back. It will actually go on to our listening log that is, I don't know if it's posted right now, Paul, yes or no, is it posted yet?
Yes, it is posted.
Yes, great, thank you. And then we will update it after each meeting with all the new comments and suggestions and feedback that is received. The team is gonna work to address all ideas and proposals as possible. And some of them we actually just need to take back and have discussions around. But all of that information is posted on the listening log and is public for everybody. Again, I'll say it again. Oh, I wasn't ready, go back. Oh, it's too fast for me. There we go.
Sorry about that.
It's all good. Again, please do not disclose any protected health information. It is a really big deal if we do that. So please keep any case examples or questions very, very, very high level. And then any specific questions or comments or suggestions that you may have going forward, you can use the home health inbox. Thank you, Christine. And then the webinar recordings and other materials are also going to be posted online. All right, now I'm ready. All right, the goals for this meeting, just as a reminder, for this particular work group is to really openly collaborate with everybody while we conduct a thorough review of the regulations themselves. we want to work with the participants to revise language that is outdated or unclear. We want to identify areas that need edits, rephrasing, clarification, removal, restructuring, yada, 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 all the things. So really, we're looking to bring these regulations up to speed, get rid of outdated language, and just make them a lot more clear and easy to follow. Next slide. Overview of the rules. The rules can be found on the Secretary of State's page. There's a link there. There's a draft of the rules. So the draft of the proposed changes are posted on the home health website. Christine is just killing it with all these links. Thank you, Christine. And then please, 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 now, tomorrow, yesterday, all of the days, please provide your feedback throughout this entire process. It is extremely important for us to hear from you. Next slide, please. All right, so general considerations, just some high-level things. As we review the rules, please remember that we are recording and documenting your feedback. So everything that you provide, whether it's verbal, written, it is all recorded and documented in our listening log, which will be public for everybody to see. Certain words are changed throughout, such as client is changed to member, just again, trying to update the regulations, and that's one of the updates. In some cases, reorganization was necessary to help make things more clear, more readable, those types of things. So maybe sections are just moved around a little bit. And then we added definitions for common terms and spelled out acronyms in the first instance of the use. Turns out we use a lot of acronyms, and so it's helpful to have those spelled out so everybody knows what we're talking about. Next slide, please. All right, so our last meeting was on October 16th. Thank you all who were able to attend that meeting. I actually had to miss that meeting, unfortunately. Had some things happening. But thank you all, and just kind of want to go over some of the feedback that we received from that meeting. We had some clarification being provided on remote patient monitoring and language added as to when telehealth visits are and when they are not appropriate. So the suggestion there, and that was added into the draft regulations. Levin tube was replaced with nasogastric tube, as it's a much more generalized term, so kind of updated that language there as well as suggested. Another conversation that we had was around taking out the word or when discussing being able to assist or direct care, and it was specific for ambulation, bladder care, bowel care, and dressing. And originally we had proposed taking out the or, had a lot of discussion with you all. You guys provided some great feedback and determined that it actually was best to just leave it as is based off of your feedback. So thank you for that. And then remove the phrase long-term home health services do not require prior authorization under the section there, and replaced it with that they do require prior authorization, and which appropriate section that references, because long-term home health services do require prior authorization. All right, next slide, please. Okay, so we're going to walk through. So the goal of today really is we're hoping to walk through the somewhat finalized version of this red line draft, really kind of give you guys eyes on the whole thing, the changes that have been made thus far, with hopes that we can then, our next step is going to be moving this forward to Medical Services Board. So we're going to go through the red line version. We'll go through one small change on Appendix A that was added in around ordering, prescribing, and referring providers, added in a couple of additional provider types. And we'll discuss we're going to show you all the prior changes and decisions, and then the acuity tool wording and placement. So the new acuity tool that is coming, where that is going to be placed within the regulations as far as being referenced to that tool and the use of that tool. All right, Paul. Want to jump into the red line, or?
Yeah, do you want to take just a quick pause here to see if anyone has any questions or concerns what we've gone over so far?
Any questions from anybody? Oh, it was so clear and concise, and extremely wordy. All right, so we are going to go, there we go, thank you. Just waiting for, okay, cool. Okay, so this document is extremely lengthy. As you all will know, I think Christine put the link in so you guys can look at it online as well. In each of the comments, thank you, Paul, that makes it a little bit easier to read. Each of the comments will kind of give you a general overview of the areas that were changed. So if you want to go down in the first comment box, There we go. As you can see, the definition was pulled and where these things and these changes came from. So we're going to go through this a little bit fast because a lot of this you've seen, a lot of it is pretty benign as far as it's the same definition that we created in a different section or things like that.
And I just wanted to jump in real quick, Candace. If anyone has any questions as to why things are changed or where they came from, all of these meetings have been recorded and they are posted on the long-term home health website. You can go back and rewatch the meetings and find out exactly what was discussed and why. Just want to kind of give that out there. So if we do go through it a little bit quickly, there is explanations on there on the long-term page. So, and if I'm going too fast, please let me know because I don't want to cause any motion sickness as we're sitting here.
Yeah, and also if you have questions, don't hesitate to raise your hand. All right, so we had a very lengthy stakeholder process for the private duty nursing regulations. And so what we did is we took that work and we're able to apply it into these as well so that we have a consistency for definitions across the services here. These are still just definitions. So thank you, Paul. This is where another little elevator music would work, huh? Okay, so is this where do we want to go back up again from, there's a comment from Lindsay, a little bit higher, right here, referencing the document here. Do we need to address any of these additional ones, Paul?
We don't. These are just things that we're going to put into rule, or if need be later on. Just want to make sure they were still recognized. I did want to point out too, if you've made a comment or a suggestion or had a question or anything, and it was previously on here, please go check the listening log as we have gotten together as a department and have gone through and answered all those questions and addressed all those. So if you don't see something here, they will be on the listening log. What is in here, the comments that you'll see here are things that we are changing. So I just want to make sure that is clear to everyone. So nothing's missing, it's just in a different location.
Thanks, Paul. All right. And keep on going here. Yeah, we got that updated. Yeah, again, a bunch of these are.
Yep, and this was changed back.
Thank you. As you can see, a lot of the updates here are really around clarifications and then just updating some of the basic word from client to member. That's all pretty straightforward.
And this is also addressed in the listening log. We reached out to our friends at Hippo who addressed this question.
Thank you. Sure.
May I pose a question that might feel inflammatory? I don't mean for it to be. I'm just going to preface it with that because I don't want anybody to be like shocked by me. We're all working for the same wonderful mission and goals. So there are concerns about the potential for overuse of services among our families that provide care. I'm not making any direct accusations here, but I'm saying it is a thing. We talked recently about like big billboards that are advertising and things. I just have a concern that there is a conflict at some times for people who deliver that care, and it's their salary. We talked in previous like it's been quite a long time ago, about looking at the way that we pay for that for everybody. In other words, having some sort of caps on hours worked for service providers, irrespective of family, non-family, whatever, so that folks weren't employed by multiple agencies over hundreds and hundreds of hours per week. Is that addressed in our rule in any way at all? And I say this with as much respect for everybody's work and for the members and families that are delivering this care. I don't mean to be like, there's no grievance here. I just want to make sure we're correct in the way that we watch this, monitor this, etc.
Yeah, it's really about the number of hours being worked at one
is.
shift and making sure that it's not overdoing any human
Yes,
capacity to do so.
anyone, yeah.
We did that. We have the 16-hour limit per shift in the PDN regulations. Do we have that here as well, Paul?
There are some regulations in here about 8 hours, but I would need to double check for the 16. I'm not sure if that's going to change.
We can look at that. We do want to mirror the requirements from the private duty nursing regulations, but we did put that in those.
So it's an 8-hour shift for what?
I think we need to look at that one.
Okay, so we'll just look at it. It's just
Yeah.
my request for us to review that and make sure we bring it out to the light of day. So that's good.
Great. All right. Let's keep going here, Paul.
Okay, yep.
Yeah, long way to go. There you go. Okay, I was gonna say, let's scroll down to something where we have a comment box here. So yeah, so this was just around the clarification on whether or not you can have long-term home health in a IRSS setting. IRSS is the host home type of setting for the developmental disabilities waiver. So it's the residential setting. And this is just providing that clarification there for that. Okay, you could probably just scroll down to the next comment, Paul. There we go. So additional feedback and clarification suggested here. Another one where there was contradictory language, so we addressed that. And as you can see, there's just additional suggestions that were incorporated. We really appreciate all of the suggestions and feedback throughout all of these pages here, because it is a lot for you all to go through and comb through as well. So thank you for taking the time to do that. All right. So, we had a long conversation about whether or not we should list the nurse aid tasks or not. And we received overwhelming feedback that we actually should leave it in the regulations. And so in the regulations, it shall stay. So that's going to be the preference and made more sense to everybody. Yeah, and this was the other one we discussed around removing the word or. And again, there was overwhelming feedback to leave that in. And so we have done that.
It's going to be a little bit of a long scroll here as we go through
All
this.
right.
So I just want to let everyone know.
We're going to, not a whole lot between here and the next one, which is good. I mean, there's not a ton of changes or updates necessary throughout this process in these pages in particular. This is still just a list of the tasks. And the section's good. It talks about the CNA limitations here, just to make it clear as to where their limitations lie. A clarification on how this is to be applied. Go ahead, Paul. While he scrolls down through the next ones, any questions or comments or feedback thus far from anybody? Any additional changes or suggestions that you all have prior to this moving forward to the next steps? Like we said, we really just wanted to make sure that everybody had an opportunity to see the latest round of all of the changes all at once and all together. Some of the information and the feedback we had received in previous groups was it was hard to piece it together, to do it in chunks, and so we wanted to make sure we did it all together. Sure.
I know with trepidation you call on me. Sorry. I wanted to also call something else out. We talked before about having full awareness of the multiple services that may be going on in one member's home setting. Is it in any way addressed in the rules? So, and I'm not even saying that there's anything inappropriate about that. I'm just saying we wanted to have clear sight into if you're receiving, this service and this service and this waiver and this waiver. And is there anything in the rule, or should it address some sort of acknowledgement of the multiple levels of care or service that are available or delivered to any one recipient?
So licensure rule requires, and Steve, feel free to jump in, requires there to be coordination across agencies when there's multiple agencies into a home and they're required to coordinate with each other. I don't know if we also address it in these regulations here, Paul.
There's nothing in here that says about care coordination, but it is a rule. I mean, that's a requirement for all home care agencies to do that.
Right.
Okay, so they wouldn't know what's going on in waiver land, though, necessarily, right?
So, and Steve, you can probably jump in and provide the particulars here for home health agency for licensure rules. So chapter 26, I believe, they are required to know and coordinate with any other care that's coming into the home. And so it's not specific to whether it's another home health agency or not.
Mm-hmm.
It's
Okay.
any care coming into the home. So I believe they are required to work with all of them.
Okay, good. I don't know if we need any sort of mention of that, but I do think it's important that we are promoting and driving that, collaboration, because we have different services that sit separately, and I don't want us to be sort of unaware of everything that's happening. If that's
right. Yeah,
okay.
Absolutely.
Okay.
Looks like we have a comment that came in. While you can keep going. I'm gonna. Do CMAs have a portal or email to communicate with the new agency regarding concerns about duplication of services? So CMAs absolutely can communicate and work directly with the home health agency. There's not a specific portal for them to communicate, but they just would work just like they would with any other provider agency. They would work directly with the home health agency around concerns around duplication of services. Does that help with your question?
That's very good. Thank you. Yes.
All right. Almost to the bottom of these. Look at that. Okay, some new process here with the operational memo that went out. And then some additional clarification. Okay, great. Thank you. Good. All right. This might be a new world record. All right. Are there any other major comments or changes, Paul, about the last couple of pages here?
I don't believe so, but I'm going to go through them just real quick here.
Okay, so that is really the changes that we're proposing for these regulations. We also have Appendix A, like we said, adding in the 2 provider types for the ordering, rendering, or ordering, prescribing, and referring providers that we're proposing as well. Those are the summary of the changes there. Any questions, comments, or feedback? Will EPSDT remain in place after July 1st, 2025? Yes, EPSDT is a federal requirement. As far as I know, the feds are not getting rid of it.
They just updated their 200-page update. So it's very much alive and well, and their focus.
Thanks, sure. Everything else is changing.
Well, that's true. Even at a federal level, things are changing. But as of right now, no plans to change that.
Any other questions, comments, or feedback for us on these proposed changes? All right, you want to jump back to the slide deck, Paul? When and how will the new nurse assessor process be addressed? So Cassie, if you want to jump in as well on that, but we are in the process of procuring a vendor right now. Should be posted, and so we have to wait for that to go through, finish the procurement process, and then if changes are made that would affect the regulations from that process, then we would open the rules back up. But we're looking at this spring, summer of 2025. And like I say, Cassie, if I missed anything, you can feel free to jump in. Okay. All right. Thank you, Paul, for adding that in. Other things? They're slowly coming in. No? All right. What's next? So we are going to continue to accept any feedback and make adjustments and changes as necessary. We are hoping that you all have some additional comments. There's a stakeholder feedback form that Christine just posted in the chat. You'll also please feel free to send an email. Just put in the subject line long-term home health rule comments. Just helps us filter it and make sure that we get it into the right place. You can look for recordings that are posted on the website, but just send us any feedback that you have. Outside of that, our next steps are going to be working on getting this draft document up to the Medical Services Board so that we can get these rules updated and ready to go. Next slide, Paul. One more plug for questions, comments, or feedback. Yes.
Hi, my name is Kristen Waldrop, and I have a quick question.
Sure.
So on 8.520.7.E, it's the additional required member chart documentation. Is all of that blue lined or taken out because the rules have changed, or because we're not including the verbiage from those CFRs?
Let me find. Go ahead, Cassie.
So for the reason those are crossed out, I think I know what you're looking at is what way rules were done previously is what we would do an incorporation by reference. So basically saying we're adding into our regulations, you have to comply with this federal set of regulations, but you don't need to add the address and all of that thing. So it was an older way and really inappropriate way of doing regulations according to the Attorney General's office. And so we are just removing that piece. All of those things are still required. So you'd need a signed copy of the written notice, evidence of a face-to-face visit. We're just taking out that incorporation by reference. Okay. Trying to shorten this rule just a bit because it's so many pages.
Thank you for that question. Any other questions, comments, feedback? No? All right. Is there another slide for me, Paul? There's our contact information with the email inbox. And then again, you have all the links that Christine has been posting in the chat throughout the meeting for you all to provide additional feedback, different ways to get in touch with us, the website so that you can see all of the postings of the recordings. The full draft rule is all posted up there as well. So anything, the listening logs, you can see if you provided feedback in a previous meeting or email, you can find it posted there. If you want to see what other feedback we've received, go to the listening log. Again, it's updated after each meeting. And with that, I'm going to thank you. This was an incredibly quiet, it must be pre-holiday lethargy. I'm going to go with everybody's already ready for the holiday to come, right? But I want to thank you all so much for joining us today. Shauna, that's a good question. I'm not sure if there's somebody on that can tell her where to find the posted RFP. But I want to thank you all for joining us today. I want to thank you for all of the helpful feedback that you have provided us thus far. Please continue to provide feedback and give us information. And I'm happy to give you back about an hour of your day because everybody likes that. It's the gift of time. All right. Thank you all again so much, and I hope you have a wonderful Thanksgiving.
Thank you.